Hi, I'm Dr. Kian Karimi, board-certified facial plastic surgeon here in Los Angeles, California, and medical director of Cosmo France, makers of the Dermasculpt Microcannula. The Dermasculpt Microcannula is a revolutionary way to perform injectable fillers. The filler procedures can be done atraumatically with very little pain and, most importantly, very little, if any, bruising. The microcannula itself is made from high-quality stainless steel that's imported from Japan. A lot of research went into finding the perfect balance between flexibility and flow of the filler through the microcannula to come up with the Dermasculpt Microcannula. All cannulas are not made equal, and the Dermasculpt Microcannula really is that perfect balance between flexibility, stiffness, and flow that you want when you're performing microcannula treatments. The Dermasculpt Microcannula is the most commonly used microcannula here in the United States, and it's actually the first FDA-approved microcannula for use here in the United States as well. I hope and trust that you'll find the Dermasculpt Microcannula to be an important adjunct in your office and a very effective way to perform microcannula filler treatments. I now use the microcannula in over 95% of my injections, and patients have come to really love the procedure results with the little pain and no bruising. Performing a filler treatment with a blunt microcannula is significantly advantageous, mainly for little to no bruising, very little, if any, chance of injecting intravascularly to cause a stroke or blindness, and it's virtually pain-free when performed correctly. The Dermasculpt microcannulas come in different gauges and lengths and can be used with any fillers on the market today. The sizes for injectable fillers range from 30 gauge, being the smallest of the microcannulas, all the way to 22 gauge for the widest of the microcannulas. In general, the 30 and 27 gauge microcannulas will be used for hyaluronic acid fillers such as Restylane, Belotero, or even Juvederm. The 27 or 25 gauge microcannulas are also used for hyaluronic acid fillers that I just mentioned. The 25 gauges I use mainly for Radiesse or Juvederm Voluma, and you can even use Perlane through the 25 gauge. And then the 22 gauge microcannulas should be used with heavier fillers like Sculptra, Artefill. You can even use Juvederm Voluma or Radiesse with that as well. There are 16 gauge and 18 gauge Dermasculpt disposable microcannulas, but those are really for fat transfer and are not indicated for injectable fillers. Additionally, there are different lengths available with the microcannulas, ranging from 1 inch to 2 inch and even 2 3/4 inches. Initially, when making the transition from traditional techniques of injectable fillers to microcannula injections, there is a little bit of a learning curve. Early frustrations can be overcome by carefully observing the techniques that will be described in this video and with just a little bit of practice in the different treatment areas. In general, I recommend starting with cheeks and midfacial augmentation. Once you get a grasp on that, then you'll really be able to branch out to the other treatment areas that are a little bit more tricky, such as tear troughs, temples, noses, etc. The Dermasculpt Microcannula has really revolutionized my filler practice. I love that you can use the microcannula with really any filler on the market. My patients really enjoy the fact that they know that they can come here, get their filler treatments, and they're going to be able to go to dinner with their friends or family and not have any bruises. And that's really important for patients, as a significant bruise around the eyes, mouth, or really anywhere can be quite distressing for that patient. The microcannula is becoming more and more popular as a favorite use of many different practitioners, ranging from facial plastic surgeons, dermatologists, plastic surgeons, and oculoplastic surgeons, and is more and more becoming the standard of care for filler injections anywhere to minimize the risk of complications like injuring a vessel, injecting into a vessel, and potentially causing disastrous complications like necrosis, blindness, or stroke. I strongly believe that the microcannula will become the standard of care for all injectable filler injections in the future. The safety that's added with using a microcannula is really advantageous to minimize the chance of an adverse event. During the consultation with the patient, you're going to want to assess the candidacy for injection of facial fillers. Initially, you want to make sure there are no medical contraindications for the treatment and that the patient is not on any blood thinners and is not pregnant or breastfeeding. Or if they have an active inflammatory condition such as an autoimmune disease that's affecting their soft tissues of their face. Once you've determined that your patient is an appropriate candidate for injection of facial fillers with a microcannula, you want to plan the treatment area and determine exactly which areas you want to treat and which injection ports you're going to use to access those areas. Always obtain informed consent prior to injection of facial fillers. Many of these fillers, as you know, are injected off-label, and it's important to discuss that with your patient. Even when using a microcannula, I still discuss the risk of possible bruising and other complications such as necrosis and, of course, worst case scenario, blindness or stroke. Standardized photography is crucial for assessing before and after results of injectable fillers, especially if you're performing subtle injections to enhance one's own natural beauty and not really transforming their face as we do here in our practice. Once you've analyzed the face and taken photographs, you can then prepare the patient's skin with an alcohol swab if you're doing any treatment on the face. You can alternatively use a chlorhexidine swab, but just be careful around the eyes that no chlorhexidine gets into the eyes. I perform injectables on the face with a semi-sterile technique using just regular gloves and alcohol swabs. When performing augmentations in other parts of the body, I will actually use a sterile technique because the vascularity and the risk of infection is slightly higher in areas other than the face. Numbing cream is optional, except for the lips. When performing treatment areas such as the mid-face, temples, tear troughs, chin, really anywhere except for the lips, I don't use numbing cream at all. On the lips, because they are quite sensitive, I will use numbing cream, but I don't have to use dental blocks. The following are the basic steps to perform a filler treatment using the Dermasculpt microcannula. First, remove the filler from the package to prepare for injection. Secure the Dermasculpt microcannula on the syringe and twist the lock. Be sure not to twist too hard as you may crack the tip of the syringe. Prime the microcannula by pushing a small amount of filler until you see it coming from the port. This will assure that there's no dead space in the microcannula prior to your treatment. Puncture the skin with the hypodermic needle that comes with the microcannula that you're using. For example, for a 27 gauge microcannula, you may use a 26 gauge hypodermic needle, which actually comes in the microcannula package. A little tip for beginners or those that have a little trouble inserting the 27 gauge microcannula through the 26 gauge port, you may actually use a larger hypodermic needle, a 25 or even a 23 gauge, to insert with the 27 gauge cannula. Just make sure that you don't go too deep or aggressive with the hypodermic needle to create a bruise just from your injection port. After inserting the hypodermic needle into the skin, I recommend leaving it in there for a few seconds to allow the skin to dilate around the hypodermic needle. This will allow easier insertion of your microcannula. Either you or your assistant can then have the hypodermic needle removed and very quickly insert the microcannula through the skin, holding the syringe and microcannula like a pen with your fingers supported on the face to insert more easily. Some tips for success of easily inserting your microcannula through the port is to have the hypodermic needle coming out at a 90-degree angle before having it removed and inserting the microcannula, holding the skin taut so that it doesn't move around while you're trying to insert the microcannula. On the cheeks, for example, you can pinch the cheeks to hold the area taut, or on areas of bony prominences like the temples or around the mouth, you may want to stretch the skin with your non-dominant hand so that you stabilize the injection port prior to inserting with the microcannula. Once you push the microcannula through the skin, you'll often feel or even hear a slight pop, and that tells you that you've gone through the dermis. Once you've gone through the dermis and you've entered into the subcutaneous tissues with your microcannula, You can then choose which area you want to treat and what plane you want to inject your injectable fillers. If you're doing both deep and superficial injections, it's advisable to perform the deep injections first and then the superficial injections on top of those. The thinner the microcannula, the more superficial your injections can be. For example, with the 30 gauge and the 27 gauge microcannula, you can actually inject into the deep dermis or at the dermal-subdermal junction. For thicker microcannulas, such as the 25 or 22 gauge, you're going to be in the subcutaneous fat, or you can go deeper and directly above the periosteum. While advancing your microcannula, if you want to remain more superficial, you just need to bend the cannula in a certain orientation towards the face so that the cannula tip actually will bend up. And this balance between the flexibility and rigidity of the Dermasculpt microcannula is one of the reasons why it's the best microcannula to use. While performing your treatment, use your non-injecting hand to help sculpt the tissues and to confirm where the tip of your microcannula is. You can use a gentle fanning technique to inject small aliquots of filler while performing the treatment. Use your non-dominant hand and finger to mold the filler as you're doing it, and you can actually inject both anterograde and retrograde while performing the gentle fanning technique in the treatment area you're using. The gentle fanning technique is going forward and backward with the microcannula in the treatment area that you are augmenting and injecting small aliquot of filler while you're performing that. You can actually do the fanning without injecting filler to tunnel the areas that you want to inject to stimulate the dermis, or just to assure that you have a smooth glide plane. The only area that I would caution you to not use a fanning technique would be in the tear trough or in the periorbital region, as you can get a lot of swelling in that sensitive area. The fanning technique is nice to use in treatment areas such as the cheeks and around the mouth, as you can push small aliquots of filler, sculpt them as you're performing the injections, and you can actually stimulate the dermis by mechanically going back and forth against it while performing the treatment. If you encounter resistance while advancing your microcannula, don't try to force it. Back up a little with your microcannula, stretch the tissues to give yourself some counter traction with your non-dominant or non-injecting hand, and then slowly advance again. You should always be able to find a nice, smooth plane while performing the injection techniques. Once the treatment area is complete, remove the Dermasculpt microcannula and apply gentle pressure for hemostasis. After the injection is complete with the Dermasculpt microcannula, I recommend that patients not exercise for 24 hours. I also recommend that they use post-fill cream to minimize the chance of even a tiny little bruise, although bruising is really rare. In the tear trough and infraorbital hollow area, I recommend that they apply cool compresses or ice packs to the area that was treated just for a few hours after the treatment is complete. Many patients will ask whether or not they should massage the areas that were treated. In general, I don't recommend that they massage the treatment areas. The only exception to this is if there's been a treatment with a heavier filler, such as Radiesse or Sculptra. If they do see a little bit of nodularity or irregularity, I do recommend that they massage the area very gently with the pad of their thumb using a little bit of moisturizer. I have all of my patients come back 2 weeks after the injection to assess the results and determine if any additional enhancement is required. I take photographs at that 2-week visit as well and compare the before and after results right then and there. As with traditional fillers, be sure to advise your patients of signs and symptoms of infection, granulomas, or any other adverse consequences of injectable fillers. When performing injections of the tear trough or the infraorbital hollow, I'll first plan my treatment area and visually look to see what areas of depression that we're going to fill. I always insert my hypodermic needle right on the head of the zygoma to come away from the treatment area in the tear trough to minimize bruising. I like to use a 27 or 25 gauge 1.5 inch microcannula, and I prefer using Restylane or Belotero in the tear troughs. After I perform the injection with the hypodermic needle, For example, if I'm using a 27 gauge, 1.5 inch microcannula, I'll inject with a 26 gauge hypodermic needle right on the head of the zygoma. I will have my assistant then remove the 26 gauge hypodermic needle while I'm holding the skin taut with my non-dominant, non-injecting hand. I will then quickly insert the microcannula as I'm holding the syringe like a pen until I can feel or hear the pop, which indicates that I've gone through the dermis. As soon as I've gone through the dermis, I will then change the orientation of my syringe so that I'm really traveling perpendicular to the skin towards the medial canthus. I advance the microcannula in a nice, smooth glide plane just deep to the orbicularis, or sometimes slightly deeper on the infraorbital rim. If your patient is feeling discomfort while you're advancing the microcannula, this could indicate that you are either too deep or too superficial. If you see the microcannula through the skin or find that it is catching the skin while you're advancing, this indicates that you are too superficial. I recommend advancing all the way to the medialmost aspect of the area that you're going to treat in the tear trough, and then slowly and gently injecting the filler retrograde while you watch the immediate correction occurring. As I'm injecting the filler, I will use my non-dominant hand to gently feel the tip of the microcannula to confirm where I am and to do gentle massages of the filler for evenness and homogeneity. Once I'm happy with the medial aspect of the treatment in the tear trough, I will then pull back on the microcannula until I'm almost out of the skin but still in the skin, change the orientation of the microcannula if I'm going in a different direction, for example, the middle part of the infraorbital hollow or the lateral aspect of the infraorbital hollow. I will then again repeat the steps that I just mentioned with slow advancement until I'm in the depressed area, slow injection, gentle massage until I'm done. In the tear trough and the infraorbital region, it's very important to minimize the number of passes you perform because this area can swell even if there's no bruising. You can use a 30 gauge, 27 gauge, 25 gauge, and even a 22 gauge microcannula. It just depends on the depth that you're injecting, the filler that you're using to inject with, and your comfort level with each of the different gauge sizes. I recommend starting off with a 27 gauge, 1.5 inch microcannula, and then depending on the filler that you're using and how you like the feel of the filler coming through the microcannula, you can adjust the different gauges and lengths. In this area, I recommend using hyaluronic acid fillers, and I typically will use either Restylane or Belotero in the tear troughs. A lot of times patients will come in and ask to have their nasolabial folds augmented. I rarely, if ever, will just augment nasolabial folds alone. It's typically a mid-facial augmentation that's needed or a cheek augmentation. When performing mid-facial augmentation and treatment of the nasolabial folds, I like to use a port that's in the middle or lateral aspect of the cheek, really in the mid portion of the cheek, over the buccal fat pad. One way to determine where you want to put your injection port for the mid-facial augmentation is place the microcannula superficially on the skin and then do a back and forth motion like a window wiper so you can figure out exactly where the fulcrum of that vector is going to be. Once you've determined that, I will re-prep the skin with an alcohol swab. I will either pull the tissues taut, or in the cheek you can actually pinch the tissues so that it's stabilized. For the cheeks, I'm most commonly using a 25 gauge, 1.5 inch microcannula when performing fillers with Juvederm, Restylane, Perlane, or Radiesse. I will insert the 23 gauge hypodermic needle through the injection port and allow it to dilate for a few seconds. Then, while I'm holding the tissues stabilized in my non-injecting hand, either myself or my assistant will pull out the hypodermic needle and then quickly insert the microcannula through the skin. It's important to hold the microcannula and syringe like a dart or like a pen to stabilize your hand and be able to effortlessly enter through your insertion port. Once you have gone through the dermis, you'll typically feel or even hear a little pop, letting you know that you're in the right place. Once I've entered my injection port, I'll determine if I'm going to do a deep injection, a superficial injection, or both. Very oftentimes I'm injecting both, and so I'll start with the deeper injections and I'll come down until I'm close to the bone and inject along the anterior face of the zygoma and maxilla. And it's really important to remember that medial cheek, because that's very often an area that's depressed. And if you have a patient that's deficient in their tear trough and their medial cheek, you really need to fill that medial cheek, or else you're going to have a suboptimal tear trough augmentation. One of the really neat things about the microcannula is that you can reach all different areas with one injection port. And as you can see, I can actually reach the alar facial crease by cheating the skin and pinching it a little bit to reach a little bit further from where I am through my injection port. Through this one injection port, you can augment the lateral cheek, mid-cheek, medial cheek, and alar facial crease. And this is a complete mid-facial augmentation. If you do have the occasion to just treat the nasolabial fold, you can actually make the injection port just on the inferior aspect of the nasolabial fold, and then come along the length of the nasolabial fold, being sure to inject the filler medial to the fold and not into the fold itself. I would recommend using a 27 gauge 1.5 inch microcannula, or even a 25 gauge 1.5 inch microcannula with the filler of your choice. All different kinds of fillers can be used for midfacial augmentation. If you're going to be using heavier fillers such as Sculptra, Radiesse, or Juvederm Voluma, a deeper injection is recommended. When augmenting the marionette lines, also known as the melomental troughs, I will typically imagine the treatment area to be filled as a three-dimensional prism, with the lateral aspect of the prism being the fold that's coming in, and the medial aspect of the prism really inserting into the lower lip. The point of the prism is going to be at the junction between the chin and the cheek. Once you've determined where you want to put your injection port, I will prep the skin with an alcohol swab, and then I will hold the skin taut with my non-dominant or non-injecting hand and insert the hypodermic needle. For the melomental trough corner of the mouth, I will typically use either a 27 gauge 1.5 inch microcannula or a 25 gauge 1.5 inch microcannula. For example, when using Juvederm to augment the corners of the mouth, I like using a 25 gauge 1.5 inch microcannula. Either your assistant or yourself can remove the hypodermic needle, hold the tissue taut with your non-dominant hand so that when you insert the microcannula with your injecting hand, you can inject very easily. I would recommend holding the syringe like a pen or like a dart and going perpendicular against the skin so that you can insert very easily. Once you've felt or heard the pop indicating you're through the dermis, then reorient your cannula to travel parallel to the deep surface of the skin up towards the corner of the mouth and lip region. Be very careful not to be too aggressive in this region, as you can come through the mucosa of the lip if you're not careful. One tip to really know exactly where you are when you're augmenting this region is to perform what I call a bidigital technique, where you put your finger inside of your patient's mouth and stabilize the corner of the lip while you're performing the injections. This will not only allow you to sculpt the filler as you're injecting it, but it will allow you to stabilize the corner of the lip and to know at all times the exact depth of your microcannula while performing the treatment. I prefer using a 25 gauge 1.5 inch microcannula in this region, and I will typically use fillers such as Juvederm, Restylane, or Radiesse in this region. When performing injection of the lips, it's really important to assess the aesthetics of the lip of your patient first. And you want to maintain the ratio of 2/3 lower lip versus 1/3 upper lip show. If you maintain this ratio of harmony, you can have really great, successful lip injections. The next thing you need to determine is if you're going to augment the white lip, the red lip, or both. And in the red lip, you need to determine if you're going to just augment the vermilion border, the body of the lip, or both. In younger patients where I don't want to augment the lateral aspect of the lip, make your injection port 1 centimeter from the oral commissure, right on the borderline between the red and white lip, on the red lip itself. Use a 27 gauge, 1.5 inch microcannula when performing injections of the lips. When performing injection of the upper lip, insert the hypodermic needle, allow it to dilate for a few seconds. Then you or your assistant remove the hypodermic needle and quickly insert the microcannula through the injection port. Very slowly advance your microcannula, as the lips are sensitive, towards the Cupid's bow. Once you've reached the Cupid's bow, slowly inject your filler and you'll see the Cupid's bow expand and augment, and then retrograde, you can inject filler on your way out through the port. By starting 1 centimeter from the commissure, you'll assure that you will not over-inject the lateral aspect of the upper lip, which can be very anesthetic, especially in a young patient who doesn't have a volume deficiency in this area. Once you've augmented the vermilion border, then determine if you want to augment the body of the lip itself, the red lip. If you do want to do this, you can advance the cannula again towards the treatment area that you'd like to augment and slowly inject filler here. The plane of injection really should be just submucosal, and this is a very delicate and thin area, so use of your non-dominant hand to stabilize the lip as you're performing your treatment is very important here. In the older patient, start from the oral commissure, because oftentimes you will want to augment the white lip as well. And with one injection port, you can augment the entire upper white lip and red lip through one port. Use your non-dominant hand or fingers to massage and sculpt the filler as you're injecting it. Once you have completed the treatment, also use your fingers to sculpt and massage the filler in the appropriate place. When augmenting the lip in a younger patient, start 1 centimeter from the commissure, and you can actually perform augmentation of the entire lower lip through just one injection port. If your patient's lip is a little bit longer, you can use a 2-inch microcannula instead of a 1.5-inch microcannula. I prefer using a 27 gauge or 25 gauge 1.5-inch microcannula when performing lip augmentation. I recommend only using hyaluronic acid filler such as Restylane, Juvederm, or Belotero. I'll typically make one injection port for each of the upper lips and just one injection port total for the entire lower lip in the younger patient. And in the older patient, I'm usually just using one injection port on each side at the oral commissure for injection of both the upper and lower lips. When performing augmentation of the temples, determine if you want to inject deep, superficially, or both. You can make your insertion port either superior to the temporal fossa or inferior to the temporal hollow. I usually come inferior to superior and make my injection port just anterior to the temple. Once you've made the injection port with your hypodermic needle, quickly insert your microcannula, holding it perpendicular to the skin until you can feel that you're through the skin. Once you're through, determine what plane you're going to inject. You can inject either deep or superficially with your cannula treatment. If you're injecting superficially in the temples, it's very important to massage with your non-dominant, non-treatment hand to really evenly distribute the filler in this region. I recommend using a 27 gauge 1.5-inch or 25 gauge 1.5-inch microcannula depending on what kind of filler you're using. You can also use a 22 gauge microcannula for the temples. I prefer a 25 gauge 1.5-inch microcannula when I'm performing augmentation of the temples, which I will commonly do with Radiesse or Juvederm. You can also use Restylane in this area, Perlane, or Sculptra. When augmenting the temples, you can actually perform a brow augmentation at the same time by coming to the lateral brow from your same injection port. This can really be a nice volumizing effect and add improved aesthetics in the periocular region. When performing filler treatments of the hands, I will actually use a fully sterile technique and prep the patient's hands with chlorhexidine or betadine. when I'm performing injections of the hands, I will also use sterile gloves and a more rigid sterile technique. The hands don't enjoy the same vascularity that the face does, and the chance of infection here is greater, and so that's why more caution is exercised in this area. When performing injections of the hands, have your patient make a fist and make the injection port with your hypodermic needle between the knuckles. Come very superficially with your injection as the skin here is quite thin. Either you or your assistant remove the hypodermic needle and insert with a 25 gauge 2-inch microcannula to perform augmentation of this region. When augmenting the hands, you'll want to inject the filler just subdermally in the subcutaneous tissues between the tendons on the back of the hand. I usually will inject from distal to proximal and massage with my non-dominant hand or non-injecting hand while performing the treatment. For the hands, I would recommend using a 2-inch microcannula, and therefore you can use either the 27, 25, or 22 gauge microcannulas, all which come with a 2-inch length. You may choose any injectable filler you like for the hands, such as Radiesse, Juvederm, Perlane, or even Restylane. When performing injections of the neck or décolleté, you're going to want to apply the same principles as any other injection area. Plan your treatment area, insert with the hypodermic needle away from the area that you're going to treat, and then you can come anteriorly with your microcannula after you've inserted through the skin. If you're starting to treat areas of the body in general, then you're going to want to use larger microcannulas like a 25 gauge or a 22 gauge. And you may also want a longer microcannula as the décolleté and the neck is a larger treatment area. So you're going to want to use the 2-inch lengths for these regions. When performing filler injections of the nose, or liquid rhinoplasty as it's often called, there's 2 injection ports that you're going to want to use. The first injection port is at the supratip, where there's a thick, porous skin. The second injection port that you can use is right between the eyebrows in the mid-glabellar region. If you want to augment the tip or middle vault of the nose, or if you want to mask a bump by filling below it, then I would recommend using the supratip injection port. What you do is you prep the skin with the alcohol swab, pick up the tissues of the skin and insert quickly with the hypodermic needle. I will usually use a 27 gauge 1.5 inch microcannula for this region, and I'll insert through the skin with a 26 gauge hypodermic needle. I will then remove the hypodermic needle while I have the skin taut in my non-injecting, non-dominant hand, and quickly insert perpendicular to the skin with the dermosculpt microcannula. Once I've felt that pop through the dermis, I'll actually keep going until I feel cartilage, and I know that I'm below the nasal musculature or nasal SMAS for deep injections, which is very important in the nose. Once I have reached the depth that I like, then I'll gently curve the microcannula and start to aim it more parallel to travel along the dorsum of the nose, or if I want to come off to one side or the other, I can do that here as well. One tip when performing injections of the nose or liquid rhinoplasty is to constantly be picking up the tissues of the nose so that you assure that you are injecting deep. If you inject too superficially in the nose, you can have problems with nodules, necrosis, and it can be a mess. I would only recommend using hyaluronic acid fillers in the nose, as calcium hydroxyapatite and some of the other fillers can be problematic here. If you just want to mask a dorsal convexity or a dorsal hump, as we call it, you can actually just come through an insertion point in the glabellar region between the eyebrows. Here, again, you want to make the injection port just through the skin and travel with your microcannula until you're down to bone at the nasal frontal process. Then you can change the orientation of your microcannula to travel parallel to the nasal bones and augment this region. You'll find that it won't take a lot of filler to perform a liquid rhinoplasty, and I'm very commonly using less than half a cc or a full liquid rhinoplasty. You'll also find that the filler may look uneven and irregular as you first inject it, which will be more apparent in the nose, but you can quickly correct this by massaging and sculpting with your non-dominant or non-injecting hand. For the nose, I prefer using a 27 gauge 1.5 inch microcannula or a 25 gauge 1.5 inch microcannula. I usually will inject Juvederm to augment the nose, but you can also use Restylane or really any other hyaluronic acid filler. The microcannula can also be used for jaw reshaping, and this will include augmentation of the pre-jowl sulcus, post-jowl sulcus, or you can actually create a sharper defined angle of the mandible. When performing jaw reshaping, you'll want to plan the treatment areas to be performed and then prep the skin with an alcohol swab. Insert through the skin with the hypodermic needle that you want to use. For the jaw, use a 25 or 22 gauge microcannula when performing augmentation here, because usually more volume is required and you're going to be injecting deeper right on the periosteum. And so the larger gauge cannulas are recommended. When performing the jaw injection, you'll want to try to inject as deep as possible to get the definition that you like first. Once you perform the deep injections, then you can come back and perform a more superficial injection depending on which filler you're using. When I'm performing a pre-jowl sulcus, post-jowl sulcus, or both injections, I will commonly use Radiesse or Juvederm to augment these areas, utilizing a 25 gauge or 22 gauge 1.5 inch microcannula. Oftentimes I'll split the difference and make my insertion point right in the jowl itself so that I can perform a pre-jowl sulcus augmentation by coming anteriorly. Once I finish that, I can use that same injection port and inject the post-jowl sulcus or augment the angle of the mandible by traveling posteriorly. This really minimizes the chance of a bruise because you are injecting in a relatively less vascular region and you're only using one injection port to treat the entire length of the jaw.
The procedure was great. Seems to be very effective. I had very little pain, if any discomfort at all. I was very relaxed. The difference to me is that I look refreshed. I feel like I actually have a glow on my face. Yes, when I had the previous fillers, I had a lot of bruising before and a lot of discomfort. With the cannula, no pain at all and no bruising.
The procedure went great, far less painful than the procedures I've had in the past. It was totally bearable, went fast, very smooth, and just one insertion point. So didn't have multiple, pins going through my lips. In the old days, you used to just go boom, 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 and it was just practically unbearable sometimes. So very happy, and it looks great.
Really good. Very little pain, a little bit of sensation of feeling something under the skin, but pain was very minimal. I was pretty shocked. I thought it was going to be much more painful, especially for the lips since they're so sensitive. And very gentle, and the results are amazing. So I'm super excited. I have a date tonight, so I was a little concerned that there might be bruising or soreness or redness to the skin, or that my friends might know, but by looking in the mirror, I can just tell the enhancement of what I was desiring, and I have no hesitation about going out tonight and having fun and enjoying myself.
Thank you for watching this instructional video on the Dermasculpt microcannula for filler treatments. I hope and trust that you'll find microcannulas to be very effective in your practice, number one for safety, but also for the comfort of your patient and to eliminate bruising from your filler practice. Visit our website at cosmofrance.net for more information about the Dermasculpt microcannulas. And you can also reach me through this website as well for any questions or concerns. We hold Dermasculpt microcannula hands-on training sessions here in Los Angeles every 6 weeks if you ever wanted to come learn in person. I hope you have found this instructional DVD to be helpful and informative. Feel free to contact me directly if you have any questions about using the microcannula in your own practice.